So good morning, class. So for our lecture 4, this is actually sa prelim pa, no? But wala na pa sa schedule. So transferred to midterms. So lecture 4 is all about abnormalities in cell growth and somatic death. So for abnormalities in cell growth, you have your retrogressive changes and also you have your degenerative changes. Under your retrogressive changes is your developmental defects. So you have here your aplasia, your atresia, your hypoplasia, and your agenesis. Under your degenerative changes is dysplasia, anaplasia, and your neoplasia. For retrogressive changes, you have first your aplasia. So aplasia basically is defective development or congenital absence of an organ or tissue with primordium. So from pagkabuhi pa lang niya, there is now the absence of such organ or tissue. For this case, you have your aplastic cutis congenita. So as you observe here, there is lack of your epidermis. So basically, very sensitive ni siya. So pagkabata pa lang niya, wala na siya epidermis. So this one, this part. Also have your aplastic anemia. So in your aplastic anemia, basically, decrease pod ang imuhang end line cells. Basically, you will have your leukopenia, so decrease in WBC, you have a decrease in RBC, and decrease in platelets, so thrombocytopenia. Since congenital pa lang, decrease na, or nanay aplastic anemia. Okay, so decreased capacity of your blood cell or your um, cell-forming organs to produce the cells, hence resulting to decrease in your end line cells, your leukopenia or thrombocytopenia. Another is your hypoplasia. So this is a failure of an organ or tissue to reach its normal size. So basically, kung nauna-una mo at least naa ang organ, however, decrease ang size niya. So this is considered to be less severe than aplasia. So you have here your congenital tibia hypoplasia. So decrease ang size sa iyahang tibia. Also have here your lung hypoplasia. So as you observe, this is the normal size of the lung and this is the hypoplasia. So decrease ang sa iyahang left lung. Okay, so basically affected of course ang functions ani ng mga organ. You have your finger hypoplasia. You have here your retrogressive changes. Atresia, another retrogressive changes is your atresia. So absence or abnormal narrowing of an opening or passage in the body. So these two pictures are different, no? Because the first, and sa taas na siya external canal atresia as compared sa baba na without atresia. So sa baba na ay opening, na ay narrowing. Sa taas na siya atresia. So basically there's an absence of the opening. So, ang sa baba, microtia, basically this is also congenital wherein there is a defective formation of your external canal. No? So, congenital microtia, external canal is defective or abnormal upon growth with external canal atresia. So, there is an absence of opening. So, of course, if there is an absence of opening or an abnormal narrowing, decrease ang senses din aside. Tapos dire na ay external canal atresia, affected gyapon ang hearing since your pinna or your external canal is responsible for gathering the sound, no, to deliver it towards your inner ear. So defective gyapon, but it is of course less severe as compared to your external canal atresia. Another is agenesis. This is a complete failure of an organ or tissue to develop with no associated primordium. So this is an penile agenesis. No, so na ay scrotum, however, no penis. This is your testicular agenesis. You also have your Mayer Rokitansky Hauser. So basically, this is also congenital wherein there is a failure, no, of the development of the, I think, external 2/3 of the female reproductive. So the vagina, There is a failure of which. So we go now to the degenerative changes. First is your dysplasia, as discussed before. This is an atypical hyperplasia, no? So there is a malformation. So basically, there is an increase in the immature cells as compared to the mature cells. No, so increase in immature cells, decrease in the mature cells. We also have delayed cell maturation and differentiation, and this is often indicative of an early neoplastic process. So we have here, as discussed also in the last meeting, the four major pathological microscopic changes. So basically, this is the normal cell or normal histology. And as you compared here with the abnormal architecture and arrangement, no? So naanay difference. So there is a poikilocytosis, there is anisocytosis, there is hyperpigmentation or hyperchromatosis. So siguro upon further magnification of this, you would see also the presence of mitotic figures. So here, discussed thoroughly, shown, no, in the picture, the anisocytosis, poikilocytosis, the hyperchromatism, and the presence of mitotic figures. Again, your anisocytosis or anisocytosis, there is a difference between the sizes, no? There is a difference between the sizes of your cell. So you would see these are smaller cells, larger cells, so lahi sila og size, no? For poikilocytosis, basically there is a difference between the shape of our cells. Okay? So, naatay mga round, this is yung RBC. Round, naatay teardrop shape, naatay oblong, no? Hyperchromatism, on the other hand, basically depends on the pigmentation. No? It refers to the pigmentation. So basically, klaro man po, no? These are hyperpigmented cells. Next, of course, the presence of mitotic figures. Upon higher magnification, you would observe, no, the presence of the different mitotic figures. So you could see here na ang kanina cell, prophase pa, na ay metaphase na nagline sila sa sa center, no, prophase. So that is basically present in cells, no, that are dysplastic. Especially also if mag-go na siya dito, diretso na siya dito sa CA na stage. So these are normal cells, and these are these plastic cells. As you compare hyperchromatism, hyperpigmented ang iyang nucleus. As you compare the size, no, this is your normal cell size. This is the normal cells. These are dysplastic, so basically they are smaller. But also not all na smaller ang atong dysplastic cell, napiuban nga they are larger than the normal cell. Another degenerative changes is your anaplasia. So basically, development of cell towards more primitive cell type, no, from adult cell type to embryonic cell type. So pabaliktad ang iyang growth from adult to embryonic. So as compared, no, sa pathologic na mga cell adaptation, if ma-stop na ang stimulus or ang stress, basically mag-stop na pod and mag-start normalize sa cell adaptation. For your anaplasia dili, even though the injurious agent is stop, magpadayon siya develop towards the more primitive cell types. Next, familiar ang tanan sa neoplasia. So basically, causes are your carcinogens, mainly due to your DNA alterations. These carcinogens will alter your DNA. So this would lead to the transformation of proto-oncogenes into oncogenes or the loss of tumor suppressor gene function. So basically, your proto-oncogenes are proteins that helps in cell differentiation, in cell growth. However, if there is mutation of these proto-oncogenes, it will lead to the formation of your oncogenes, which are your cancer-forming proteins. No? So basically, also you have your anti-tumor or tumor suppressor na on na anti what do you call this? Anti-oncogenes. However, if na mutation ato, it will also decrease its function, no? So loss of tumor suppressor gene function. So i-antay niya tong oncogenes. However, if there are also mutation to that anti-oncogenes, decrease na iyang function. Di na siya maka-perform sa iyang function, which is to counter your oncogenes. Remember, neoplasia is an uncontrolled growth. Hence, that's explanation sa mag-chemotherapies, no, na ang gina-target sa chemotherapy is the fast proliferating or fast growing cells. So, because gani kay na uncontrolled growth ang atong cancer, ang atong cancer cells. Hence, mauna maglagas ang buhok sa ato ang naga-chemo because your hair is a fast proliferating cells. Okay? So these are example of your carcinogens here. You have your chemical carcinogens, radiation, infectious agents that would lead now to DNA alteration. So if there is DNA alteration, there can be mutations, translocations, and amplifications that would lead to transformation. No, so musulod na sila si oncogenes, no, when there is a mutation or overexpression of your proto-oncogenes that would lead to transformation to oncogenes. And then if there is a mutation in your anti-oncogene, so it would decrease its function, no? So mo-increase yung oncogene. So we have here the general characteristics of your tumor cells. They usually resemble and imitate normal cell well enough. They are capable of secreting substances. They are, of course, parasitic in nature because they compete with the cells for metabolic needs. No? They have autonomy. They are non-responsive to normal growth control. So excessive yung ilahang and steadily increase in size regardless of environment and host's health. Okay. You have here the parts of neoplastic tissue. You have your parenchyma or the medullary and the stroma or your scirrhus. For your parenchyma and medullary, basically dila makita ang active elements of the tumor. No, usually they are made up of cells which proliferate excessively. As compared to your stroma or the scirrhus, dira makita ang lymphatic and vascular channels. This is a connective tissue framework with the lymphatic and the vascular channel. Remember, important ang stroma. Why? Because it is the way no na makalat um ang ato ang what do you call this? Cancer cells. It is through your vascular channels and your lymphatic channels. Dira mag-start ang metastasis. Okay? And also, if there is an for example, there is what do you call this? Atrophy of the surrounding na mga structures. For example, when there is a tumor in the brain, no? So the active elements of tumor, the parenchyma will be increasing its size, enlarging, hence compressing the surrounding tissues. Okay? Classification of tumors, of course, you can classify it based on its capacity to produce death, no? Benign or malignant. So when you say benign, as you all know, they do not usually produce death. They are more common in younger age. Okay. They grow slowly by expansion. They are not fixed. Of course, they are not metastatic and no cachexia. As compared to your malignant tumor, they are the ones that causes death. They are usually found in older age group. However, we also have our malignant tumors na also isolated sa mga younger age. Now, for example, your papillary thyroid carcinoma. However, it has a good prognosis but it is more common or common na siya karon sa ato ang younger age. Your malignant tumors grows rapidly by infiltration or by expansion. They are fixed to tissue and the ultimate death is usually due to cachexia. And of course, it is metastatic. It may metastasize. So again, benign versus malignant, benign normal cells, less mitotic figures, no, not hyperchromatic, less tendency to hemorrhage and necrosis. As compared to malignant, they are undifferentiated cells because they have increased mitotic figures, no? Hyperchromatic and more tendency to hemorrhage and necrosis. As remember the four, anisocytosis, poikilocytosis, hyperchromatism, and of course the presence of your mitotic figures that is present, no, in also in your malignant tumors. So based on histologic characteristic, it can be carcinoma or sarcoma. So in carcinoma, these are in solid tumors, no, malignant tumors of epithelial origin. So there are less tendency to produce supporting stroma or supporting tissue or trauma. So these are examples: the carcinoma of your skin, in the glands, digestive and urinary and reproductive. So usually 50% of the tumors in women are carcinoma. As compared to sarcoma, these are the tumors of the connective tissue in origin. So there is a presence of your intracellular tissue framework. So example of which is a sarcoma, no, sa bone, adipose tissue, muscle, cartilage, in the bone marrow, and lymphatic and immune. So basically, this is considered as rare form of cancer, but increasing in number na ni sila. Grading of tumors attempts to establish an estimate of the level of malignancy. This is based on the cytologic differentiation of tumor cells and number of mitosis within the tumor. So also this is a guide for treatment and prognosis. As a rule, well-differentiated tumor are less malignant than undifferentiated tumor or differentiated cells. This is an example. Also, this is based on the again degree of differentiation of tumor, degree of pleomorphism, mitotic index, degree of anaplasia or undifferentiation, also an estimate of the rate of growth and degree of invasion. So this is an example of grading. However, in different carcinoma, different sarcoma, different po ang atong grading. Okay, so dagan kita grading sa CA. Example is the Broder classification. So if the ang assessment sa pathologist, ang differentiated cells is within 100 to 75% and 0 to 25% ang undifferentiated, then therefore it's grade 1 and so basically again your classification is a guide, no? It's not a guide, however, it is an assessment of the treatment. No, for example, nag-start high treatment and again there will be assessment of your grading. Then maano nimo if effective ba ang treatment or not. Also with the prognosis of the patient. So upon diagnosis ang assessment nato is metastatic na, then it's already stage 4 diretso. Remember that if it is already metastatic, it is already stage 4. No, kung nag-metastasize na siya, affected ng other organs, then it is already stage 4. So let's proceed to somatic death. So this is a total irreversible cessation of cerebral function, spontaneous function of the respiratory system, as well as your circulatory system. So you have three primary changes. No, first is a circulatory failure. No, first, of course, na fail is your nervous failure. No, so there is a cessation of your cerebral function good first, and then your circulatory and respiratory failure will follow. Okay. So circulatory failure, of course, cardiac function ceases, and the absence of your pulse and heartbeat. And also have your respiratory failure. This follows no your cardiac failure. Of course, if wala na blood na ipump si heart, therefore wala na maabot sa different organs and different body parts. So wala stop na gid ang function. So this would lead to death because of the absence of oxygen and increase of carbon dioxide and loss of oxidative process. So also nervous failure. Ang pasabot na ko ganina na mag-start gyud siya sa nervous, it's because of the cessation of your cerebral function. However, in the changes, loss ang reflexes na mawala. Okay, so loss of reflexes would be the third one. Secondary changes for our somatic death, you have your algor mortis. So basically, this is the cooling of the body, so decrease in temperature. So the body temperature decreases at 7 degrees Fahrenheit per hour. No, so this is accelerated with the cold weather, severe hemorrhage, long wasting diseases, and in lean, malnourished, and dehydrated individuals. This is slowed down by consumption of drugs, extreme physical activity, and fever. So severe hemorrhage, of course, if decreased na ang blood, of course, blood, as you all know, would supply the oxygen to the different parts of the body so that the mo na maka-contract atong muscles because of the delivery of oxygen to the different parts. No? So upon contraction of your muscle, there's heat production. Even the flowing of your blood in your blood vessels will produce also heat. Okay, so hence, if there's severe hemorrhage, decrease in blood supply, of course, that is a decrease in temperature. So this is a Glaister equation. This estimates the hours elapsed since death as a linear function of rectal temperature. So this is, I think, 33 plus degrees Celsius minus the rectal degrees Celsius divided by 1.5. Then you can estimate na kung pila na ka-oras namatay ang pasyente. Rigor mortis, this is rigidity or stiffening of the muscle approximately 6 to 12 hours after death and may persist for 3 to 4 hours, no? So, head and neck mag-start and then towards the lower extremities. The muscular activity at the time of death basically affects the position. So, if namatay siya nga nakalingkod, tapos medyo dugay siya nakuha, then you would see the patient, no, sitting na ng gahi, anak. So I remember, no, when my mom died just recently, May last week of May, I was there beside her, and then murag na ano gyud ako na recall na ko na, oh, nag rigor mortis na si mama. Murag yun ana because I was there beside her even in the cadaver room. Next is the livor mortis. Basically, this is the post-mortem lividity. There is a purplish discoloration of skin due to stasis of the blood. No, basically this is due to the gravity. Discoloration in contrast to ecchymosis, and there is an absence of blood clots. Absent when blood clots are found in the interstitial tissues. So basically, nakahigda man gyud ang atong mga cadavers, no. So due to the pull of gravity, there would be stasis of the blood in the lower part, no, kung asa ang lower part. However, this is not so clear, no, if na ay mga blood clots sa interstitial tissue. Postmortem clotting, this occurs slowly, immediately after death, no? So, settling and separation of the RBC from the fluid phase of the blood, the plasma, and makes it rubbery, no? Pag na RBC, then you can say that it is a current jelly clots, no? So we have, wala na gina-edit. Wait lang, ha? So basically, wala na siguro nakita. But there is a difference between the clot na buhi pa ang pasyente ug ang clot nga patay na ang pasyente. So in a clot, blood clots nga buhi pa ang pasyente, you would see the lines of Zan. No, you can search a picture of lines of Zan. It is a clot formed when the patient is still alive. No, there is difference between the lighter and the darker colors. It's because nga um napay kana murag tawag ani the lines of the platelet and the lines of the plasma and the lines of the RBC. Tumbuhi pa si pasyente. However, if that's a clotting after death, current jelly na siya. This one. Some also show nga naa siya murag chicken fat sa clot. Now you can search that, no. Chicken fat sa current jelly nga clots. So mo na usually ang sa ato ang post-mortem clotting. Desiccation, you have your drying and wrinkling of fluid-filled organs as well as the cornea and the anterior chamber of the eye. Putrefaction, mawala na si loss of rigor mortis due to autolysis of cells, no? As well, mag-start na ang foul-smelling odor due to bacterial invasion. So basically, this is associated with different changes, including na greenish-blue discoloration. This is due to the formation of the ferrous sulfide. You have your refraction of the cornea, loss of rigor mortis, peeling of skin, and swelling of the face, followed by your adiposity formation or the wax formation. No? Mura siya na ay wax na. Last is your autolysis. No, there is a self-digestion of cells. Then eventually it will be undergone by all the tissues. Also, putrefactive bacteria from the GIT diffuse into surrounding tissues and enhance destruction of cells. So there is a progressive desiccation, putrefaction, and autolysis that will eventually produce a total digestion of all the soft tissues. Okay? Okay. So, I will be adding no sa atong lecture. Nag-record lang ko, it's because nga wala tayo projector. But on our meeting, I will add some inputs. Okay? So that would be all. Thank you.